Right now, I want to remind everybody about how Omicron presents. This is how, so if you get Omicron, what's it going to do to me? This is what it's going to do to you.
Top 5 Zoe reported symptoms. So this is the early London data, right? Most common, runny nose. Second most common, headache. Third most common, fatigue. Sometimes the fatigue was bad, sometimes it was mild. Fourth most common feature, sneezing. Fifth most common feature, sore throat. The implication is obvious. If you have any of these and you've had colds in the past, you're going to think it's a cold, but it may well not be. It may be a Omicron cold. Need to get tested.
So that's what we're talking about. And people are getting boosted so they can fight that. People are right now running around with like chickens with their heads cut off over that. That's what people are afraid of. I'm going to show you it again one more time. What are they afraid of? What are the symptoms?
Top 5.
If I get Omicron, what am I going to get?
Symptoms. So this is the early London data, right? Most common, runny nose.
Oh my God.
Second most common, headache.
I don't want a headache.
Third most common, fatigue. Sometimes the
I don't want
fatigue
to
was
get
bad.
tired. I'll have to lay down.
Mild. Fourth most common feature, sneezing. Fifth most common feature, sore throat. The implication is obvious. If you have any of these and you've had colds in the past, you're going to think it's a cold, but it may well not be. It may be a Omicron cold. Need to get tested.
So if you get Omicron, that's what's going to happen to you most likely. This is from the New York Times. Israel considers fourth vaccine dose to fight this. But some experts say it's premature. You think? Some scientists warn that too many shots. You ready for this? Some scientists warn, this is the sub-headline. Some scientists warn that too many shots might actually harm the body's ability to fight the COVID-19 virus. But Israel experts say there isn't time to wait. So do you see what this says? So what they're saying is, some scientists are warning that, so just like Dr. Robert Malone, who just got banned from Twitter today, Dr. Robert Malone, the guy who invented the mRNA vaccine technology, he didn't invent this vaccine. He invented the technology this vaccine is built on. He was on our show a couple of months ago, and he said exactly that. He said that vaccinations aren't linear. It's like if you think it was 2 is good, 3 will be better, 4th is bad. He said doesn't always work that way. That you could get one and you get a boost and it could have the exact opposite effect. Which is what they're saying now, 2 months after he said it on my show. That's what they're saying now. He said it on my show 2 months ago, but people are always saying Jimmy Dore is crazy. Everything I've said, the mainstream media is now starting to say. Israel is considering whether to approve a fourth COVID-19 vaccine dose for vulnerable people to contain the fast-spreading Omicron variant, despite debate among scientists and a lack of evidence. Either for or against there's not enough evidence, but they say just go do it. Why? Because they're bought by Big Pharma and their tens and tens of billions, if not hundreds of billions of dollars. Billions, not millions, billions. The panel of experts is advising the Israeli government on the pandemic recognized that uncertainty, but on Tuesday, it recommended giving a fourth dose friggin' anyway. The panel of experts advising the Israeli government on the pandemic recognized that uncertainty. We don't have enough data. We don't know exactly what's going to happen. But go ahead. Big Pharma's going to make a ton of money. Let's keep it going. Concluding that the potential benefits outweigh the risk. The benefits of, by the way, remember, the benefits are it's going to protect you from Omicron. Remember I showed you if you get Omicron, what's going to happen to you? It pointed to signs of waning immunity. The panel. A few months after the third shot, waning immunity after a few months after the third shot, and said that any delay in additional doses might prove too late to protect those at risk from Omicron. Omicron, which let's remember what the symptoms are. But some scientists, like the one who we had on our show, who invented the mRNA vaccine technology, some scientists warned that the plan could backfire because too many shots might cause a sort of immune system fatigue, compromising the body's ability to fight the coronavirus, which is exactly what Dr. Robert Malone said on the show. And everybody said we're crazy. Everybody said, why don't you bring out somebody to debunk him? Now the New York Times is saying it. Isn't that weird? A few members of the government's advisory panel raised the concern with respect to the elderly, according to the written summary of the discussion obtained by the Times. The price will be higher if we don't vaccinate. The price will be higher from this Omicron, which, remember the symptoms, if we don't, said Dr. Boislev, the head of the advisory panel. Boy, I'd like to see what his investment portfolio looks like. He said at a news conference late Wednesday, describing the spread of Omicron as a kind of tsunami or tornado of mild disease. You see the words they use? It's a tsunami, a tornado of a mild disease. The tsunami sounds bad. A tornado sounds scary. A cold doesn't sound bad or scary. But if you put tornado and tsunami in there, it sounds really scary. So you better go get some more vaccines. We don't have a lot of time to make decisions. Oh! You might catch Omicron and then you might present as having a cold. You know, by the way, CNN reported yesterday they found their first death from Omicron in Texas, and that was a lie. They have to make stuff up to find somebody who died of Omicron. They have to make it up. And they will, and they're doing it. Look at this guy. Look at this guy, Dr. Boislev. He's doing his job, believe me. He doesn't get to be the head of that vaccine panel without some serious compromise in his life. I'll tell you that. With Omicron sweeping the world at alarming speed. Oh my God! The most mild variant is sweeping the globe. Which a lot of people say signals the end of the pandemic because this is so mild. But not according to the New York Times. With Omicron sweeping the world at alarming speed, governments are scrambling to figure out how to contain it in the face of significant public pressure against reimposing harsh restrictions on daily life, curbing holiday celebrations, and deepening the economic pain wrought by 2 years of pandemic. A new British report shows that booster doses are less effective against Omicron. Again, remember, Omicron's, what's the symptoms? Very mild. Than previous variants, and their effectiveness wears off faster. Within 10 weeks, vaccine makers are trying to adjust their shots to target Omicron. So you don't have to live through having a cold or something that presents as a cold. Israel has confirmed a few hundred cases of Omicron, but officials say the new variant is much more widespread and much milder. They don't tell you that. They leave that part out. The variant is much more widespread and much, much milder. They leave that part out of the story on purpose. That's not a mistake. That's on purpose. And could overtake Delta as the dominant variant in a country with 2 or 3 weeks. That's what you want to have happen. You want Omicron to take over from Delta. Why? Delta's more deadly. Omicron mild. But they still want you scared to death.
Boy.
Given the fear of major Omicron outbreak during the winter, oh my God, it looks like everybody has a cold. What are we going to do? It looks like they have a cold. Do they have Omicron? Cold. What are we going to do? How many people are dying? None. What are we going to do from Omicron when no one's dying from it? What are we going to do? Given the fear of a major Omicron outbreak during the winter, when the hospitals are already overflowing with patients and complications of flu and other respiratory ailments. Oh yeah. Back to the we don't have enough hospital beds.
Don't build more hospitals.
Don't build more hospitals.
Don't add hospital beds.
Hey, we're right at our capacity at all time. Should we build some redundancy in the richest country in the world? No.
And definitely don't give people health care.
And definitely don't give people health care, because that'll clog up the hospitals.
People will start seeing doctors.
They'll start going to see a doctor. The advisory panel voted overwhelmingly to recommend a fourth dose for people over 60, those with compromised immune system, and health workers to be administered at least 4 months after their third shots. The panel did not recommend a fourth shot for the wider population at this stage, but it did advise giving the third dose 3 months after the second. What? Rather than the current wait of 5 months. So when I got my second jab in April 17th or 19th, doesn't matter.
It's that week.
April, May, June, July. So if you would have told me, hey, you got to get another one in July, that would have really affected my decision to get that second one. And if they would have said you got to get a fourth one in October and then a fifth one in January, that would have totally changed the way I looked at those first 2 doses. Totally changed the way I looked at it. While there is evidence that Omicron, discovered just last month, usually causes milder illnesses than earlier variants, well, there is evidence. You mean overwhelming evidence? You mean that's the only evidence there is that? Just evidence. Isn't that, buddy? There's no qualifier on that. Israeli officials said that by the time they have clearer information, it might be too late. So stay shitting your pants. Professor Haggai Levine, an epidemiologist and chairman of the Israeli Association of Public Health Physicians, said that Israel was not seeing a sharp rise in infections yet. Daily infections are around 1,200 a day, down from 11,000 at the peak of the Delta wave in August. And there was no evidence that a fourth shot was needed to prevent severe illness from Omicron. So this guy looks like he doesn't have an investment portfolio and he's allowed to tell you the truth for some reason. Maybe he just has integrity. Maybe that's what's happening here with Haggai Levine. This guy's like, no, there's no outbreak happening, and there's no evidence that a fourth shot is needed to prevent severe illness from Omicron because it presents as mild. Just because we led with the third dose does not mean that there should be a fourth dose with no specific scientific basis. Who said that? That was Professor Dror Mavrach, who heads the coronavirus ward at the Hadassah Medical Center in Jerusalem. Also, he urged waiting for more data before recommending another boost.
And we'll never hear from him again.
And we'll never hear from that guy again. So just like we reported on this show 2 months ago when nobody else would say it, Dr. Robert Malone came on and said, hey, that's not how vaccines and your immune system works. It's not linear. 2 is not always better than 1. 3 is not always better than 2. 4 is not always better. Things happen with your immune system, just like they said in this. Just like all the scientists, why are they allowing them to print this now? I don't know why they're allowing them to print this, but there it is. Sometimes scientists warn too many shots might actually harm the body's ability to fight. It might actually hurt your immune system. That's what scientists are saying now. But scientists have been saying this all along. They're just now printing it. So now when people call me crazy, I can go, well, it's the New York Times, it's crazy. They'll still call me crazy for a week or two, and then they'll come around. So I predicted by March, all my friends who have their head up their ass and are repeating propaganda straight from fucking Pfizer and Anderson Cooper without one critical thought going through their head. I predicted by March they will come around. It's going to be because it's going to be the 4th or 5th booster when they're going to start going, what the F and F? Hey, we're doing live stand-up shows in Los Angeles on the 7th and 14th of January, and then we're going to be in Raleigh, North Carolina, and Philadelphia. Go to jimmydorecomedy.com for a link for all tickets.